Why knee pain? Why does the knee hurt? Excellent question. When you type in your search engine, causes of knee pain. So most likely what you're going to get is the 4 groups of causes of pain in the knee, from injuries, arthritis, mechanical problems, and other medical problems. So within injuries, you can look at the ligamentous troubles, sprains, strains, tears of anterior cruciate ligament or posterior cruciate ligament, medial collateral ligament, lateral collateral ligament. You can have fractures within the knee, torn cartilage, meniscal tears, and other injuries of meniscus. You can have bursitis, patellar tendinitis, and dislocated patella. Then within arthritis group, we know there are more than 100 types of arthritis that affect our joints, and not only the joints. The most common are osteoarthritis and rheumatoid arthritis. When you talk about causes of knee pain of the mechanical origin or biomechanical origin, you will see loose bodies. These are little pieces of broken tissues that float within the joint of the knee. Basically, what you can think of is like a little pebble inside the knee that during mechanical movement can get dislodged or pushed somewhere, irritating the tissues inside the knee. You can have also troubles with iliotibial bend syndrome, the iliotibial bend tightness, and maltracking of the patella, the improper gliding movement of your kneecap. Other causes of knee pain can have medical origin, as in cancers. There could be Osgood-Schlatter disease, especially with adolescents. You can have infection of the bones, infection within the joint. So here you might stop your search for the answer why knee hurts. However, please don't stop there. We can go a little bit deeper together. What are the generators of knee pain? What are the specific tissues that can cause knee pain? And here it's kind of funny sort of thing, because you can have phantom knee pain when the leg is amputated, where there is no knee, and the person can describe exactly where in the knee that doesn't exist they're suffering, what's killing them, what part of the knee. And of course, the generator here is not the meniscus, it's not the torn ligaments, it's not an arthritis. The generator must be somewhere within the nervous system, right? Now, let's take a look at other possible causes of knee pain. Lumbar pathology very often is manifested by knee pain. Another reason, problems with hip joint. I have worked with a few clients. One comes to mind. He's a physician, and he came to me with the knee problem. And what turned out to be is that it was the osteoarthritis of the hip joint that was causing the pain in the knee. He actually did not have any pain in the hip. Now, how about local tissues within the knee joint that generate pain? Here's the tip of the hat to a surgeon from San Francisco. His name is Scott Forsett-Dye, and he is my kind of guy. I admire people like him. How he dealt with the issue was actually undergoing surgery himself for his bum knee when his colleague would perform the surgery on him without any anesthesia. Wow, that's bravery, right? He would have his colleague probe and poke different tissues where he practically created a map, sensory map of his own knee. And sensory map of two things. One, how well he could recognize what tissues were touched, meaning front, back, side, inside, outside of his knee. And second, he would map which tissues within his knee, when probed, would give him no pain, mild pain, moderate pain, and severe pain. He published the results of his self-discovery in the American Journal of Sports Medicine under the article called Conscious Neurosensory Mapping of the Internal Structures of the Human Knee Without Intra-Articular Anesthesia. And here's his map. This is the cross-section of the knee. We are looking under the kneecap here, the yellow one. We see the condyles of the femur, and we see some menisci, the C shape menisci, and the black shape called fat pad. Here's the side view of the knee, front of the kneecap, femoral bone, and here the tibia with the structures inside the knee. Surprise of surprises, articular cartilage had mild to no pain, including the surface underneath his kneecap. And what was interesting to find out that on the MRI picture, his cartilage under the kneecap was in a terrible shape. It was a grade 3 chondromalacia with zero pain when they were probing underneath this kneecap and scraping and touching and probing. There was zero pain. The tissues with mild to moderate pain were the ligaments, the ACL, PCL, the deep ligaments within the knee, and the menisci. Mild to moderate pain. However, what was killing him, what was the severe pain, was actually the fat pad of Hoffa, a structure in front of the knee, joint capsule. Capsule is the bag which surrounds the joint. And very often impingement of the joint capsule can give quite a severe pain. Also, the two tissues that he identified as severely painful were suprapatellar pouch and the tendon of the quadricep muscle. So here are the general causes of knee pain and practical under the surgery without anesthesia finding. Of course, from just one patient, from one person, subjective report, but nevertheless, for me, people like him are my heroes who are willing to sacrifice their own safety and health to move the medicine forward, to move the science forward. If you found this video useful, please like it. It helps us to reach more people to find videos like that. And also subscribe so you can have access to our new videos. Thank you very much.